Sacral neuromodulation involves the stimulation of the S3 nerve that travels to the bladder. This is done via a wire that actually communicates with the bladder nerve to prevent abnormal signals from going to the bladder. If a patient is a candidate for this type of therapy, we initially start with a test lead placement. That occurs in the office and takes just a few minutes. The test lead is placed in the lower back next to the S3 nerve that runs to the bladder. Once this is done, this is taped to the back to allow us to keep it in place for a few days so that the patient can determine if they're experiencing improvement in their symptoms. If the sacral neuromodulation test is successful, meaning that there's a greater than 50% improvement in someone's symptoms, then at that point we move on to permanent implant placement. That is done in a very similar fashion, but is performed in a surgery center so that it can be done under sterile conditions. The lead is placed in the exact same fashion as it is in the office, but then with some mild sedation, a small silver dollar-sized battery is implanted underneath the skin. After a permanent implant is placed, at that time, the patient may experience some minor discomfort at the implant site, but they will immediately notice an improvement in their symptoms. The day they leave the surgery center, at that point, they're already placed on a program that's supposed to help with their urinary symptoms. Studies have shown that the success rate for sacral neuromodulation are really as high as 80%. Patients will see a significant improvement in their urgency, frequency, and urge incontinence with this therapy.